Hey everyone and welcome. Today, we're going to untangle the world of pharmaceutical patents in Saudi Arabia. We'll be breaking down the official approach from the Saudi Food and Drug Authority, that's the SFDA, to really understand how both the big innovator companies and the generic drug makers have to play the game.
All right, so here's our roadmap. We're going to start with the big picture, this tricky balancing act between innovation and access. Then we'll dive into the specific playbooks, first for the innovators, then for the generics. After that, we'll take a really close look at something called the FTO letter, which is crucial, and we'll wrap it all up with the strategies and, of course, the risks involved.
So, let's kick things off with this central challenge here. I mean, think about it. How do you protect the massive R&D investment that goes into a new drug while also making sure affordable versions can eventually reach the public? It's a huge dilemma, and this whole process is basically the SFDA's attempt to walk that very fine line.
To really get how this all works, you first have to know who's who, because everyone has a very specific job. First, you've got the SFDA. Their role is to register products. Think of them as a gatekeeper, checking paperwork, not as a patent cop. The actual patent authority is SAPE, the Saudi Authority for Intellectual Property. They issue the patents. And if things get heated and there's a dispute, well, that's what the commercial courts are for. It's so important to remember these roles are separate. And this division of labor really sets the stage for our two main players, who, let's be honest, have completely opposite goals. The innovator company wants to lock down their invention and protect it. Their main job is just to get their patent documents over to the SFDA. But the generic company, they want into that market. And their job is way tougher. They have to prove legally that their version doesn't step on any toes.
All right, let's switch hats for a second. Let's put ourselves in the shoes of an innovator company. What's their playbook look like? What do they actually have to do to make sure their patent is on the SFDA's radar?
For the innovator, it's actually pretty straightforward. They have to include a copy of their patent, the one issued by CISAE, in their registration file. If it's not issued yet, no problem. But the second it is, they have to send it over. And the rules are crystal clear. If there's any delay, that's 100% on the company.
Now, this quote right here, this is huge. And it's probably the most important thing for innovators to grasp. Just because you give the SFDA your patent, it does not mean they're going to protect it for you. They're not your enforcer. They're more like a librarian, just logging that the document exists. That distinction is everything.
So, what happens if an innovator thinks someone is ripping off their product? Their fight is not with the SFDA. They have to take it to the commercial court. The SFDA will only get involved, say by pulling a generic drug from the market, after the court has made a final, legally binding decision.
Okay, now for the other side of the story. Let's flip the coin and look at what a generic company has to go through. And gauntlet is the right word, because their path is a lot more complicated. It's packed with legal hurdles they have to clear all on their own. The moment a generic company applies to register a drug that has a patent on file, a countdown begins. The SFDA will ask them for something called a Freedom to Operate letter, or FTO. And as you can see, they have exactly 60 working days to deliver it. It's a tough, non-negotiable deadline that really puts the pressure on.
So here's how that whole dance plays out. The generic company applies, they get the FTO request, then they have to go out and hire a special intellectual property agent, one who is licensed by SAIP, to write this legal opinion. Within that 60-day window, they submit the FTO, proof of the agent's license, and one other really important piece of paper, a formal declaration.
And wow, this part of the declaration, it really puts everything in black and white. The company is signing a document where they promise their product is clean, that it doesn't infringe on any IP rights. And crucially, they're agreeing that if they're wrong, they take on all the responsibility. The entire legal risk is on them.
So this Freedom to Operate letter, the FTO, it's the absolute key to everything for the generic company. It's what gets them through the gate. So let's zoom in a bit and figure out what exactly it is and why it's so powerful. So what is an FTO really? Well, think of it like this. It's a professional legal opinion. It's a formal certificate from a qualified expert who's looked at the generic drug, looked at the innovator's patent, and is officially stating, yep, this product doesn't infringe. It is literally their ticket to move forward with the SFDA.
And make no mistake, this isn't just some casual letter. The SFDA requires this exact formal language. The agent has to put their name on it, name the product, and flat out certify that it doesn't infringe. There's zero wiggle room. It's a direct, legally significant statement.
Okay, so we've got the rules down. But knowing the rules and knowing how to play the game are two different things, right? Because inside this system, there are some pretty clever strategic moves you can make, but there are also some major risks if you're not careful.
Now check this out. This number right here is a total game changer. The system gives generic companies a massive strategic advantage. They can submit their entire registration package a full 24 months, that's 2 years, before the innovator's patent even runs out. And the best part? If they use this window, they don't even need to submit an FTO letter. It's a huge head start.
Of course, there's a catch. And it's a pretty fair one, actually. Even though the generic company can get all their paperwork done way in advance, the SFDA will wait. They won't grant that final registration until the innovator's patent has officially expired. This way, the innovator's rights are protected to the very last day, but the generic is ready to launch immediately after.
And there it is again, that same hands-off approach from the SFDA, but this time for the generics. Even after they accept the FTO and register the drug, the SFDA is basically saying, we filed this, but we're not vouching for it. The responsibility for that letter being accurate stays 100% with the generic company.
So this really brings us full circle, doesn't it? If the SDA is just the procedural gatekeeper, not the legal judge or the patent police, then where does the buck actually stop? Who is really on the hook in this system?
And it really comes down to this. For innovator companies, the risk is all about enforcement. Having a patent is great, but it's just a piece of paper unless you're willing to go to court to defend it. For generic companies, the risk is all about due diligence. If their FTO is wrong or their declaration is false, they are the ones who will face the legal and financial music.
So, let's wrap this up. Key takeaway number 1. The SFDA is a registrar, not an enforcer. Number 2, innovators have to file their patents and be ready to fight for them in court. Number 3, generics have to get that FTO and sign on the dotted line, accepting all the liability. And finally, don't forget that 24-month window. It's a huge strategic play for any generic looking to enter the market.
And that leaves us with one final big question to think about. In a system like this, where the agency that registers the product is completely separate from the system that enforces the patent, how should that fundamentally change the way your company thinks about its legal and regulatory strategy in Saudi Arabia?